Welcome to the Flourish with Functional Nutrition podcast. I'm your host, Madeline Lowry, founder of Twin Cities Nutritional Therapy and a nutritional therapy and MAP method practitioner specializing in allergies and sensitivities, chronic fatigue, chronic pain, sleep issues, infertility, and other chronic health conditions. Join me for episode 44, where we talk with my client, Derrick Johnson, about MAP sessions for recurring fears, stomach pain, allergies and food sensitivities, and high blood pressure. Hear about his experience with the advanced neural retraining method called the MAP method and how it compares to hypnotherapy. Learn about the emotional, mental, and physical improvements he noted after 6 sessions, and hear how an early life trauma can set the stage for a compounding belief structure that leads to chronic illness. As always, we must disclaim that the information we share in the podcast is for educational purposes only. As MAP method practitioners, we do not diagnose or treat disease, and we recommend working with a qualified practitioner. Now, let's speak with Derrick. Welcome, Derrick. I'm so excited to have you on my show. We met at the end of last year, and I'm going to let you introduce yourself and tell us how you found me and decided to try this new thing called the MAP method. So maybe you can give us a little background on yourself.
Okay, thank you. Thank you, Madeleine. My name is Derrick Johnson, and I found the MAP method kind of by accident. Oh, I'm sorry, a little bit about myself. Okay. So currently I'm working in IT now, but I do also practice a kind of hypnotherapy off and on the side, and I have for a while now. But personally, I've had some health challenges for a while, and some emotional issues also, and that's really what drove me to look into the MAP method. I like to read. I read a lot, and I had been reading a book on the law of attraction, and it turned out that that book was written by Colette Striker. And so, the book left me with some questions, and I did a little bit of research on her online, and that's how I stumbled upon the map the map website. So once I watched a couple of the videos on the map website, I got really excited for a couple of reasons. Okay, and which probably we'll talk more about later, but Um, I actually signed up for the MAP coaching, monthly program. I lasted in it about a month before I realized that I didn't have any time to actually do anything on the website, just because my work schedule is kind of busy. So I ended up canceling after a month, but I still wanted to explore what MAP was really about, and I wanted to have a session. And so I found you on the practitioners page. I chose you out of the other practitioners because I've suffered from a number of like food sensitivities and allergies for years, and my primary problem was actually fear, fear of illness. And so I thought, okay, probably you've run across something like this before in your work, and so I chose you. Um,
Yeah. So tell me what you learned about this. So you knew more about the MAP method than most people who end up on my doorstep. So maybe you can just talk about what you learned about this method that intrigued you and how you would describe it to someone who's never heard about it before.
honestly speaking, I think if I hadn't had some type of personal experience along those lines, then maybe I wouldn't have been as open-minded or as excited about having this type of session as someone else who had no idea about it. But because I think most people don't really have a concept of the superconscious, and probably don't realize how much of a role the subconscious mind actually plays in their day-to-day lives. Um, and so I think that if they were just approaching this for the first time, a lot of what they run into might sound unbelievable, and they might not realize like how practical it actually is, and how effective or efficient it is, to be able to work with those levels of mind. So um, like I said, personally, I practice a type of hypnotherapy on the side, and in that, I mean, I'm not actually a therapist, but it's still called, it's called quantum healing hypnosis technique. But it's still a type of therapy, because in a sense, what we're doing is we're using hypnosis as a tool to get clients in touch with parts of their mind that have access to more information. Okay, and occasionally those parts of mind have a lot more information, and that, we could call it like a higher mind, as compared to like the subconscious, which deals more with like body functions and some other things. Like this level of mind seems to actually have broader perspective, and access to a lot more information about the person. And so when I do a session in hypnosis, I pretty much just hypnotize the person and turn over control of the session to that higher aspect of mind, which understands the client far better than I ever could, and knows what the client actually needs to hear and understand.
Mhm.
But that QHHT was my primary training in hypnosis. And so while I had a lot of success with it, what I found was I didn't actually have the skills for working with the higher mind and directing it and getting it to do more. And so I decided to continue my training, which is why I only do it off and on part-time now, and I continue to study hypnosis. But there are a lot of hypnotists that don't actually work with that level of the mind as well. So it's kind of hard to find people who work with what we call the superconscious mind, or the higher mind. And so most hypnotists focus on implanting suggestions or giving suggestions to the subconscious mind to carry out changes. So I had been looking for something like that myself. And in my personal life, um, over the last few years, maybe around 2019, I reached a point where I felt like my emotions were like a pressure was building up inside of me,
Mm.
and that emotions needed to be released. I know that sounds strange, but I'm someone who actually didn't even know emotions were a big deal until about 2015.
Mhm.
And so that's kind of when emotions came on my radar, and I realized that they could be actually being held in the body and causing problems and things like that. And I had no idea, how to work with them, how to process them, how to release them. And, I to this day, I have a few techniques, that I've tried to use, but I still don't know that much about emotions. And so in 2019, I felt this pressure building and a lot of stress and anxiety. And I just felt like, something inside of me would probably like kind of explode or break soon. And I don't mean that in any type of violent way. It just felt like a dam was building up, like something was building up, a pressure inside, and it really made me nervous. so I started exploring and looking for techniques that dealt with emotions so that I could release my own, trapped emotions. And, I came across some, of course, things like EFT, emotional freedom technique.
Mhm.
Um, that helped a little bit. And then I found something called the emotion code. I
Mm.
don't know if you're familiar with that. Yeah, that one. I actually got quite a bit of relief from working with uh, the emotion code, but it was time. It was a very time consuming process, and from there I studied something called like matrix reimprinting,
Mm.
which is using EFT on like inner parts and inner child and things like that. And again, that also gave me some relief, but again, it was also a slow process.
Mm.
And my anxiety built up, and I started having more physical symptoms like shortness of breath. And
Mm.
I had to make a trip to the emergency room to figure out, why I was having trouble breathing. And this is all still in 2019. And the my primary care doctor, he ran all types of tests on me, over the rest of the year, but he was not able to find anything. And in the end, he ended up chalking it up to anxiety.
Mhm.
So um, so that's part of it. The other part was in my personal life, there have been a number of projects that I've attempted to start and have stopped suddenly.
Mm.
And I felt that there was some kind of inner block. Consciously, I wanted to do this thing. I had all the resources, I had everything I needed to actually do it and carry it out. But then there's something else inside of me that's kind of stopping me. Okay. And so I know that that's something at the subconscious level that, needs to be dealt with. But I just, I didn't really have the tools for working with that. And so that's kind of, and so when I found the map website and watched a couple of the videos, then I was so happy because I knew that just from watching the videos, if the sessions actually worked like the video stated, then I knew it'd be tremendous, tremendous breakthrough. And so I booked the session with you.
Yeah.
And the funny thing was is that when I was filling out the questionnaire on your, I don't know if it's your intake form or just informational questionnaire on your site. It had something listed about ACEs, or adverse childhood experiences, and that was actually my first time running into that expression, and I thought, what's that? So I looked it up online and I took a quiz, and I thought, yeah, well, maybe I have. Maybe I have a few of those, but I don't really feel, that I'm impacted so much by about that. But after the consultation with you in the first session, then I started to realize, okay, maybe I actually had a lot more going on than I suspected. So, um, yeah. So, yeah.
Yeah. Okay. Thank you, for sharing all that because it kind of helps to set the stage. And I didn't know about all this, but anyway, that helps to set the stage to like how you came to your first map session.
Hmm.
What do you remember about your first map session? And and what maybe what did you notice about it that convinced you that maybe you should have more map sessions? If that's in fact what happened.
Yeah.
Can you talk a little bit about that?
Yeah, sure. Um, of course, I was a little nervous about the first session, and I didn't actually know what map could and couldn't do and couldn't work with. So when I filled out the form, I came in with a list of things, and I wasn't sure what. I knew you worked with health issues, and my primary reason for showing up was actually fear, and so I wasn't quite sure, if that was okay and you could work with it. So I was a little nervous. But you told me, yeah, it could work, and I do remember you guiding me, I think, through a few a few of the memories I had, related to that fear of illness, fear of sickness. And, I, I didn't know what to expect. So I closed my eyes. I went along with the process, and um, yeah. But what I do remember, yeah, there was definitely a lessening of the intensity of the emotions I felt after you went through the process. But what really what caught my attention or surprised me was consciously I didn't really feel like anything was actually happening. I was relaxed and sitting there, my eyes were closed. There was a train of thought that was in progress, and I was for the most part just listening to what you were saying. But I did notice that my eyes started tearing up, and it was almost like I was not a heavy cry, but like crying, softly from one or both eyes. And I kept needing to wipe my eyes, and then I thought, okay, well, maybe something is being released at a deeper level, and I'm just not conscious of it because it's happening at a deeper level. But I'm having physical reactions to it, so something is going on, and so that was kind of my thought. But with as far as booking more sessions, the biggest changes for me always happened after the sessions. Okay, between sessions. And really what I noticed there were shifts in the way I perceived things. It's almost like uh information existed around me that I wasn't aware of or didn't have access to. And as I had these sessions, I became aware of this information, or the information became relevant to me, or there were just direct perceptual shifts. And I just started seeing things differently. Like the first couple of sessions, all I could think about was trying to get rid of this chronic fear, deep-seated fear. And um actually having the talks with you actually really helped, because you explained some things to me about the fight or flight response and how your body gets locked into certain modes. And it made a lot of sense. But in the process of the first two sessions, between the first and second session, it's not that the fear went away instantly, but on the other side, I started feeling more and more empowered. And so it got to the point where shortly after the second session, I felt I felt so empowered that it was almost like the fear kind of faded into the background and became a non-issue. I know we worked on it and we reduced the intensity, but I also want to say, like, I felt more and more empowered. I mean, I started to look at my life and those areas where I felt where I had fear or I felt ineffective, and I could contrast those with other areas of my life where it's easy for me to make changes and I felt empowered. And all of a sudden, I could look at those areas like health or some other areas, and I could say, okay, I've been playing. I don't want to say victim, but I've been playing small in these areas, and I haven't actually stepped up and directed it or taken it control in these areas. I've been in reactive mode from the beginning, and defensive mode almost, about it. And so, that became very clear to me. And the feeling of just the shifts in perception were so kind of life changing for me that I wanted to take more and more sessions. Even though, as you know, I turned up to some sessions and I didn't really know session to be about. I think there were a couple like that, but that's what it was for me. There were shifts between the sessions where I would just go through a tremendous amount of internal change that had kind of cascading effects for the rest of my life. And so, it was almost a no-brainer to book another session. I also came in with a list of about, 4 or 5 things I wanted to address, with fear being at the top of the list, chronic discomfort I felt in my stomach for years, um, blood pressure, problems with my blood pressure, and also allergies and food sensitivities. And, that was kind of the bulk of my list. And I think, with each session I took with you, it's almost like, yeah, there was improvement across the board. And along with my feelings of being feelings of more empowered, I made some other changes. Like I somewhere around January or February, I decided to get some, allergy testing done, like, food sensitivity testing with respect to like inflammation and, body response to it, immune response to the food. And I took a couple of tests. I took a MRT test, and I took some type of IgE inflammation test. I don't remember the details. And then you gave me a session at the, I think, end of February or beginning of March. It was the second session you gave me for blood pressure.
Mhm.
And then a week later, I mean, I did make some changes to my diet, but a week later, my blood pressure was normal and has been normal ever since. So, I've had that problem for 14 years, off and on for 14 years. And I've tried all sorts of things to get rid of it, dietary changes and, exercise. And there were times when I was able to manage it with a very strict diet and exercise. And after you helped me uncover some roots related to that with my work in the past, and we worked on that. And after that second session on blood pressure, I did change my diet, but I'm eating things that weren't. It's not a strict diet by any means now, and my blood pressure is normal every day. So, and that's a huge change. So, um, so yeah, so okay, there were physical changes and emotional changes from the sessions, but for me, the biggest benefit were kind of the mental changes, and that's really why I'm gonna sign up for more sessions, because it's just, yeah, it's huge. Like after the last session, I mean, I don't know how much, depth you want me to go into. After the last session, like not only did my blood pressure, normalize and go back to normal ranges and stay there, but also, I decided to like go back and look at, like, because we did some more things than just blood pressure in the last section. You were also helping with like some career, career changes and stress from work and things like that. And after the session, like, suddenly I got a motivation to kind of go back and look at my life and kind of like basically redesign my life from a standpoint of, happiness and joy. So re-engineer my life so that it's built around that, which is kind of a big change for me to go from survival mode to that. So that's huge. And I'm still going through that process at the moment. Yeah. So I don't know like where you want me to go, but yeah, I have plenty I can talk about.
Yeah. Okay. Wow. Well, thank you. Thank you for that. So maybe I'll just kind of summarize some of the points
Yeah.
here,
Yeah.
right? And I'll just like recap everything, some of what you've said, because you came to the method with a lot more knowledge than most people. you're a practitioner yourself in this, hypnotherapy technique. And so you already had that experience of like working with the mind is a powerful way to impact, right? Mental, emotional, and physical things. But you're just looking for something different, something more, maybe something,
Yeah, well, it's also the case that I can't do that type of thing on myself.
right?
And kind of the work I've done is it's kind of, getting or collecting information. So, a client comes in with uh some problems, and the higher mind will basically tell us, okay, what the root cause is, and how it's impacted your life, and some things you could do to change it. But I lack the skill set to actually ask it to make the changes, in that way. And so I've been to other practitioners, but personally, I myself, I'm extremely analytical. And so it makes me not the best client for hypnosis. I mean, I of course I can be hypnotized and get benefit from it, but it's been tricky to find the right combination of it's been a little challenging. So the beauty of your method is that I don't actually have to be in trance.
Mm,
Yeah, and so I think, for someone who's analytical, what you do is perfect, because I can be there with you the whole time. I'm not very visual person. I'm not good at visualizing, but I do meditate. I do other things, but my memory is only so. So, there were times when we were working together, and memories would just pop up related to what we were working on. And with your method, you could just scoop all of those up at once and deal with them. And it was so efficient, so elegant. But and I haven't seen that in any other methods. So it's really impressive. I'm just kind of so happy that I found this. So but I just don't know, and you probably have a better idea about this than I do, of just all the ways that it can be applied or used. Like I'm looking at this and I'm going, okay, well, together we worked on a lot of issues from my childhood and some experiences that I had as an adult. But I'm sure there are other ways that it can be useful or practical, in my life. But I just don't know enough about the technique, and I still haven't had time to dive, fully into it as I'd like to, because yeah, there's just too many things going on. But yeah, I that's another thing. When we were going through the method, there were times when it was almost like we were following a thread. We would work on one issue, we would go through the technique or process, and then related ideas would pop up, memories would pop up, and we could follow those chain of memories. But there were times when nothing popped up, or my mind drew a blank, and you were still able to work with me, so thank you for that. But because I know I wasn't giving you very much at that time to work on. But I don't so that's it. I don't fully understand, and I guess I shouldn't, all the ways that the map method can be applied. But it's got so much potential. I mean, that much I know. So
yeah. Yeah. So maybe I'll just speak to that a little bit, right? So just to clarify, the MAP method is a method of advanced neural retraining. Most people have heard of the basic methods, things like, oh, I don't know, EFT or EMDR or DNRS, dynamic neural retraining system, or others. But this is like the next generation of those methods. Would you agree with you? You've
definitely,
experienced,
definitely.
yeah. So this is like the next level. It was developed by an experimental psychologist in Canada and then further refined by Colette Stryker, the author of the book that you read. She systemized it, she made it more applicable for everyday situations. Now, she was a psychotherapist herself, and she specialized in anxiety and depression, those
Okay.
kinds of things. And she wanted to use it for that kind of thing. So the original creator, he spent, I think, 15 or 20 years working with a patient population that was much more extreme, bipolar, multiple personalities, right? Schizophrenia, very extreme kinds of personality disorders. And he developed it by himself. So it was very particular to his way of thinking and working and his patient population. So what Colette Stryker really did was she took his method, which was under a different name at the time, and she saw the potential in it. She repackaged it
Hmm.
and she made it teachable. So that was a big thing she did, because up until then it was like we had one practitioner in the world. Now it's being taught to the MAP Coaching Institute. So now we have, like 150 practitioners in the world. I mean, it's still not that many, right? It's still a very new technique, a new method. But I think you are right. It does have a lot of potential. So she started out using it for anxiety and depression, and it's very good for those kinds of mm, psychotherapy kinds of application. She also applied it to so she focused on a niche. Once she understood, like you did, like this has so much potential. Anxiety and depression is just like scratching the surface,
Hmm.
or fear or guilt or whatever your emotional whatever that emotion is for you, that's sort of just coloring your life, right? So she saw that once people could resolve their fear and their anxiety or their depression, or their PTSD, that they would be able to turn their attention to their dreams and desires. And so she began to use the method for performance enhancement. So she started to
Okay.
work with concert pianists, Olympic athletes, just people who are high performance individuals. And so that became her specialty with the MAP method. I don't think she has time for private practice these days, but that is, so that's kind of what she did with it. And so if you look through the MAP Coaching Institute website and you look at the list of practitioners around the world, you will find that many of them are still using it for more like the psychological kinds of
Hmm.
things. Others are using it for sort of like goal attainment. Um, some have carved out very particular niches, like I only work with children that have,
Hmm.
ADD or like learning disabilities or something. But there aren't so many of us that focus on chronic health issues. I can maybe think of 6 people. I mean, so it's not a big group.
Right.
But because I came from the field of nutritional therapy, and I had been working with people with allergies and sensitivities, and I thought, oh, when I teach a basic neural retraining method to help people resolve those things, I'm also observing that all these other kind of chronic, long-standing health issues seem to get better as well. And so that taught me something about, the stress response, and how being someone with a lot of allergies and sensitivities by definition is means that we're the kind of person that's kind of stuck in a stress response a lot of the time. And just being stuck in that stress response takes a toll on your health over the months and years, right? And when we can resolve that stress response, when we can retrain the brain to tolerate all these substances again, then we can spend more time in the parasympathetic response, which is known as the rest, digest, and heal response, right? No restorative functions of the body can happen unless we are in the parasympathetic mode of the autonomic nervous system. And so, just by freeing someone from being stuck in this fight or flight response, their health improves, like over time, over the weeks and months after the training, or,
the method I was teaching was very much a do-it-yourself method, which required, months of like repeating these scripts and doing these affirmations, right? So, I mean, over those months, we would see these health changes, and I thought, oh, this is, something important that I'm seeing here. I need to remember this. Then when I found the MAP method, I immediately recognized that it would be helpful for both of these things, right? Not only could we work with allergies and sensitivities in a much quicker way, right?
Mm-hmm.
We could deprogram and reprogram the mind in a set of sessions. Maybe it would take 4 or 6 or something like that. But we could also quell this stress response, whether it's from allergies and sensitivities or anything else, right? Traumas from childhood, traumas from any point in life. And that would have an effect on health as well. Now, you talked a little bit about kind of the sequence that we went through. So you and I have done maybe 6 sessions together,
Mm-hmm.
and they're kind of spread out like we started in November of last year, and maybe the most recent one was the end of March. So it was kind of like, spread over a few months. And, we started out with the kind of emotional topics like you described, like
Mm-hmm.
fear, right? This kind of unrelenting fear, and this kind of the repetitive thoughts that went with it, right? That
That's
drove
correct. Yeah.
fear. And we found connections, to traumatic experiences in your life. And once we resolve the painful emotions around those experiences, then somehow that took down the edge of the fear that you're experiencing in your current life, because the current fear was somehow tied to these experiences from before, going all the way back to your childhood. So I think we probably spent the first 2 sessions on
Mm-hmm.
kind of emotional topics, and then we kind of switched to, you wanted to work on a physical symptom, and you wanted to work on blood pressure, high blood pressure, and I think we spent at least maybe 2 sessions on that. There's probably one more in between there. And then
Mm-hmm.
I think our last session was more like around career and work
Mm-hmm.
stress and career and things like that. And you've, helped us understand sort of how these sessions affected you, not just on a emotional level, but also a mental level and a physical or physiological level.
Mm-hmm.
And so I want people to understand that, kind of like that these patterns on all levels could be affected just by working with the mind, you know, subconscious programming in the mind, and emotional stressors that have built up over the years in your subconscious mind. Like, you want to talk about that a little bit? Like how you see that? Like how, you know,
Yeah, definitely. There is a hypnotist. His name was Stephen Parkhill. I think he's passed on by now, but he wrote a book called Answer Cancer, and he admitted that it wasn't the best name for a book, but he'd worked with a lot of cancer patients and terminal patients, and he had been able to basically heal them. And according to the technique that he used was called regression to cause, and he would regress the client through hypnosis to an earlier time period where they felt a similar emotion, and then trace it all the way back to the root, the very first time they experienced it. And usually along with that motion, the emotion came a thought like, I'm not wanted, I'm not good enough, I'm bad. It usually went back to something that happened in childhood, or even in the womb. And the way it works in hypnosis, there's this idea called the compounding power of suggestions. And so you start off as a small child, and you have this traumatic experience, and maybe you feel bad, and then you're adolescent, and you take another emotional hit of a similar nature, and it kind of reinforces that initial belief structure of self dislike, or self punishment, or I'm not good enough, or self hate. And you take another hit, and with each successive emotional hit or traumatic experience of a similar nature, your subconscious reinforces that suggestion, and the physical symptoms get a little bit stronger. And so, whereas it may start off, you trip a lot, or you fall a lot, you're clumsy and uncoordinated. And as you get older and you have more of these hits, then it manifests as a small illness. And later on in life, you get a divorce, and that's a big emotional blow and of a similar nature, and it reinforces that. And then, it starts manifesting as a larger and larger, more serious illnesses. And so what he found was that, you know, at any level or stage of that expansion or growth process, even if you even if you treat the symptoms at that level, because the subconscious mind has something set that it wants to do, it'll find another way to express the same problem. So even though you've dealt with this set of symptoms, well, okay, well, if you block me in this direction, I'm going to show up in this way. And so you can treat the symptoms, but the problem will keep coming back because the root cause is not actually dealt with. And I think a lot of people these days do know that, trauma. I mean, there's a lot of research that supports that trauma actually, causes a lot of physical issues and conditions, further down the road. But I don't know like how mainstream that is yet. How well that's been accepted into like the mainstream like thoughts. So what he found was that if he, in some patients, if he could get all the way back to the initial event, then the whole house of cards would fall, and even the current systems would disappear or go away altogether and not come back, as long as you got the root cause of the root event. But even if you got close to it, like the next layer, then it would still take time for the conditions to come back, because it would start building again. So I mean, I don't know if that's kind of similar, I guess, but I guess the idea is still that I don't know how many people actually know that, what happens or what beliefs or emotional trauma or that's stored at the subconscious level actually affects their. I think most people don't know to what degree the subconscious mind actually affects, their life circumstances, their health condition, their life circumstances. I think there's more. There's research that was out a few years ago that said that like the subconscious mind was making a decision like 7 seconds before the conscious mind was even aware that it had made the decisions, before it decided it had made the decision. So it was almost like the illusion that the conscious mind is actually making the decision. It was so heavily influenced, beforehand by the subconscious mind. And so, I think in our lives and I mean, our health is probably no different, because our eating patterns, our habits, our ways of expressing ourselves or holding in emotions or releasing emotions or growing angry, those are all like habits or it's conditioning, right? Like you get triggered and then you respond in this way. So I mean, it's definitely been eye-opening for me just how much control over my life my subconscious has had. And it's not that I'm a victim of my subconscious mind. I mean, I don't mean to say that, but I mean, these days I just have a lot more awareness about how how my health and my life are being impacted from that level of mind. So I've gained a lot more respect um, about what's in my subconscious mind and about what goes into it, and through working with you also, like how to clean up some of that. I think that definitely, probably a lot of what people have trouble with, not just health issues in life, is probably traceable back to something that's sitting in their subconscious that they're not even aware of.
Absolutely. Yeah. I see it every day. Every day.
Oh wow.
Like literally today, 3 times. Yeah.
Yeah.
You talked about, you found the MAP Coaching Institute. You watched these videos. They got
Yeah.
you excited about what the method could maybe do if the videos could be believed. Now that you've had 6 sessions, like when you look back at that, I mean, do you feel like the method lived up to what you expected or were hoping for?
Yeah, it definitely exceeded my expectations.
Mm.
That's why I'm excited about it. I mean, I've recommended it already to a couple of people I know, like a friend that's had again, childhood trauma, but related to the family. Definitely, yeah. I mean, I'm still excited about it, and like I said, I'm planning on taking more sessions. I just, you know, finding that was a little bit difficult. I found it backwards. I mean, I don't know how many people would find it, other than word of mouth. It's a bit difficult to find.
Yeah.
And I think there's another a similar technique called MAPS or something like that. And so um, I think, yeah, I just think that so much can be done with it, and it's wonderful. But again, someone has to have an open enough mind to try it. And I don't know like what your experience has been with clients, or when you talk to people about what you do, like how open they are or receptive they are to it. But it's amazing. It's amazing. That's all I can say. It's amazing. But how do you get people to try it?
Yeah, I agree. Well, hopefully, it's through stories like this, right? And so, when you recommend the MAP method to
Hmm.
people, what kinds of situations, or like what kinds of characteristics about the issues, make you think, oh, the MAP method would be good for that?
Well, since I've worked with you, definitely it's easy for me to recommend it for anyone, um, that has allergies or food sensitivities, And I know some people like that. Um,
So, did you see improvement in those areas?
yes, yes, I did also. Yeah, there are things I had trouble eating before, and they're better now, and uh, they cause less issue. I probably still need to book a session with you and show you, some results I had from earlier, but I don't even know if those results are applicable now.
Yeah. And you and I didn't even do a session for allergies and sensitivities.
No, no.
Yeah.
But it's hay fever season. I've had hay fever since I was 7, and there's almost nothing now. I mean, now I do notice that I cough a bit after I have some wheat, but other than that, yeah, there's almost nothing now. And again, like friends that I know have had like kind of severe trauma.
Mm.
Like I know I have a couple of friends who are already in therapy, but they're in more of the traditional therapy. And traditional therapy is not usually working at the subconscious level, which is why it takes so much longer. And those are people I definitely recommend map toward, because it's we're operating at two levels, right? Consciously, everything is okay and everything is fine, and subconsciously, we're terrified of cats. Two completely different models of the world, but the subconscious is a lot stronger, and so you're still terrified even though it's a kitten.
And what about, do you have any advice for anyone who's curious but sort of on the fence?
Oh,
Anything you
definitely,
wish you
yeah.
had known before you came to your first session?
If they're on the fence, I would say they have nothing to lose by going ahead and booking the 15-minute consultation with you. And
Mm,
I would say, just you actually had like an introductory like session on your site that wasn't the full session, but I think 60 minutes.
yeah.
And but just to go ahead and step in at whatever level they're comfortable with, and just keep an open mind and give it a try, because there are some amazing things out there that people are just not aware of, because like you said, what are there, 150 practitioners? So you're not really going to hear about this pretty much other than through word of mouth or someone who's gotten results. So if you're lucky enough to have heard about this method, then you know I recommend 100% you give it a try, because you'll save yourself a lot of time, and uh, probably money as well too. So uh, yeah, I recommend that people just, have an open mind and give it a try, because how are you going to know without giving it a try? So, um, but I mean, there is no real cure for a closed mind. Something just has to happen. People have to just give it a try.
Mm. Yeah. Yeah. And I should probably point out here that, just doing the introductory session might not
Hmm.
give you enough data to really know what um, what
Yeah,
is possible. What do you think about that?
that's true. I mean, after I took the introductory session, I decided to go ahead and book 3 sessions, to give it a proper try. But I did walk away from the first session with enough of an idea that I did want to do more. So, I mean, I would rather somebody try one of those sessions than not give it a try at all.
Mm.
So, because it's just something you don't want to miss, because it's a tool or a resource that people can come back to in their lives if they're stuck or challenged. And it's just so effective, and time saving. So, it would just be a shame for someone to not even have exposure to it.
What would you say about like what it was like to be a client and sort of what was expected of you, you know?
It was pretty easy. I mean, I would show up for a session. We discuss what I wanted to work on, what was my priority for that day, and you would ask me some questions and collect some information around that area of focus, and then we would decide, what we would work on for today and attack it from that way. And I would close my eyes, and you would lead me through the process, and mentally, new or related ideas, sometimes random thoughts would or seemingly random thoughts would pop into my mind while we were going through the process. And then once you were done the process and did a check-in with me, then I would relay what I was experiencing to you, and I would also let you know about some of the other ideas that popped into my head, or things that occurred to me, or realizations or changes in perspectives I had also.
Mm.
And um and then you give some feedback or some ideas about that, and then maybe we would follow up again with another round related to the new things that popped up, or we would go in a different direction if you thought that might be more fruitful. So it was pretty easy from my side. I mean, I just needed to sit there and talk to you about, the changes that had happened, or what I was feeling, or what I wanted to work on. So it's pretty easy. Um, I think, now that I have more time, I would go back and look at some of the homework you gave me. About a time, like I think one was like a timeline of events or traumatic events, something like that. That's valuable. I think you worked on a lot of issues with that, even things that I didn't even consider to be trauma, but you you let me know that they were actually, things that from a child perspective could be considered, traumatic. So anyway, but it was easy. I mean, yeah, I love the sessions. I always leave the sessions feeling much better than I did when I started the session, and excited about the changes that are going to pop up in the next few days or weeks after the session. That's really what I was looking forward to. Not the immediate, what I would get immediately from the session, but I just knew after the first couple of sessions that, there was this cascade effect where more and more, things would change and, open up for me, or, ideas. And so it was all positive and empowering. And so, I just wanted to take more and more sessions, but you didn't recommend that. You kind of checked in with me, and you found, okay, well, you suggested, a month later
Mm.
might be good, or
And yeah, um, so this overachiever kind of pattern that I see. Some of my clients are like, "Oh my gosh, this was so great. Can I come twice a week?" It's like, "Oh no, this is not like talk therapy where you come every week or twice a week.
Mhm.
It's not really like that. And there actually is a benefit in having an interval between sessions, as you said.
To
There's
integrate
like,
the changes. Yeah.
yes, exactly. It's
Hmm.
like some things are changed, some rewiring happens in the session, but the full effects of the session do take some time to to be felt, and even on a physiological level, right? Like if we can, you can imagine if you can down tick the stress response, like 1 or 2 levels. Well, the physiological benefit of that may not be recognized for a few weeks. So at the end of each session, I would ask your subconscious mind, is there a recommended interval for the next session? And then I would just tell you what I got. Sometimes it would be a week, sometimes it would be 2 weeks or 4 weeks, or and sometimes there was no particular recommendation. It was just like, well, whenever the next topic comes up for you that you want to work on, that's when you should schedule a session, right? There's no particular time frame. So yeah, that's kind of how I work. And I think for people who are willing to trust the process, I mean, that it's that's one way to work. Other people, like, just their schedule is such that they just want to know, okay, I'm going to see her every 2 weeks, and and that's fine too. I mean, I think it's whatever you want it to be, but there's no advantage, I don't think, in like
Hmm.
scheduling a lot of sessions close together. It just kind of takes the time it takes. I don't know. Yeah. Does that ring
Hmm.
true to you?
I mean, I definitely felt that I needed some time to process the changes. And like I said, a lot of the shifts happened for me within days after the session or shortly thereafter, and they continued. And so it was very easy for me to connect the changes I was experiencing, physically and emotionally and mentally with the sessions, because that was pretty much the only thing I was doing differently,
Oh,
and it opened up a lot of new avenues. And because it's easy to say that, okay, well, my blood pressure is normal now because I changed my diet, but I've been changing my diet for 14 years. I've tried lots and lots of things. And it was only after that last session with you that, the week following week, that was it. It was just normal, and it's pretty much stayed normal, since then. And I log it every day. And so, um, I'm just wondering, like, at some point I'm gonna have to go back to my doctor with my list of data, blood pressure data, to him and show him, look, this is what it is now. So, but I just want to say that, yeah, those changes do take time, but not that long. Like in my case, it was days, or days, basically, like within weeks. And in the case of the last two chefs, not the last two, I think the last session was more in Korea, but the two previous ones were on blood pressure, and I still felt shifts even after the first one, even though there weren't changes in my blood pressure at that stage, but I did feel shifts anyway. But after the second session, um, yeah, the next week, and it just stayed. So I'm very grateful for that. Um, but I mean, it could be easy for someone to come along and say, "Well, oh, you changed your diet and got strict about it." But I'm not. I did change my diet, but it's I'm eating things that I couldn't eat before. I for the most part, I do still leave out a couple of things like corn and wheat, but everything else is there. I'm still eating other grains, and there are no issues anymore. I can still have sugar now, and my blood pressure is normal. So it's really weird, and that wasn't the case in the past. So, definitely changes have taken place, and yeah, it's easy to write it off because this type of work is not really tangible, right? It's not visible. And so, the doctor can give you medicine, but the medicine doesn't really fix the problem. It just, manages the symptom. But, you're working with something here that's not, it's not really like quantifiable by people, you know, they're not used to it. And so I think it's easy to discount it or say, oh, I did it. Like, you know, the woman that comes, you know, I want to lose weight. I haven't been able to lose weight for 5 years. You know, I had your session and 6 months later, all the weight is gone, but I made the changes, you know, I changed my diet and I exercise. But that session played some role in that. It cleared some blockage that allowed you to make the changes, you know. So I think people just need to keep that in mind. Like, and they should know, because there are a lot of people that have the willpower or the desire to do something, but they're still not able to make those changes. And that's because there's more likely than not, there's something at a deeper level that's, you know, blocking them or holding them back or protecting them. You know, a lot of it is protection. So, um, and you may not feel like that, but you know, consciously, but the subconscious mind, you know, weight may be protection for you. So, and until those blockages and things are cleared and dealt with, and like I said, your session, your map session is one of the most efficient ways I've seen of dealing with that type of thing. So sorry, I'm rambling.
Yeah, yeah. No, that's yeah, no, it's perfect. That's I think that's the point I just wanted to bring out.
Yeah.
Yeah. So any any thoughts, anything you wanted to cover that we haven't talked about yet?
Only that what was surprising for me was when you explained about the immune system. And,
Mm,
you know, again, fight or flight response or things like that. It's just the whole idea that your whole nervous system could be on alert and you know, overreacting to everything because it's been on high alert for so long was really kind of eye opening for me. So, you know, if there are people out there that suffer from chronic conditions or even you know, immune related problems, then this is definitely autoimmune problems. This is definitely something that's worth looking into. Definitely. So, you know, that's pretty much, you know, yeah.
yeah, yeah, right, right. Yeah. So let me just connect a couple of dots there. So like we talked about before, how certain beliefs about yourself, you talked about the root causes there that that can underlie a condition like cancer,
Hmm.
can also underlie, well, any chronic health condition, right? What people have to understand is that the subconscious mind runs all the systems of the body and always has. When you were in perfect health, it was thanks to your subconscious mind, right?
Mm,
Monitoring everything, calibrating, and carefully, managing all systems, right? You never had to think about it.
that's right.
Suddenly, though, health declines and you start thinking, oh, you know, well, the approach from medicine is something's broken here, something's broken. Your thyroid, not working, your whatever, immune system, whatever. There's something's not working anymore. But there's never an explanation of like, well, why isn't it not working? Is it not working? Well, it was working last month. How come it's not working this month? Or it was working
Right.
last year. Why not this year?
Right.
Like, has something, what has changed? And I think that we don't often we don't think about the role of the subconscious mind in this. And as you said, the subconscious mind is like a storehouse of beliefs. These beliefs get reinforced by different things that happen in our lives. And as certain belief may start to take precedence, it can contribute to the function of different systems of the body. And so what I see is a lot of people who have allergies and sensitivities, there's a belief of being defenseless, helpless, powerless, insignificant, unheard, um, small somehow, uh, and this plays out in the body as a limbic system, the danger sensing system of the brain, alarming all the time, inappropriately, right? It's looking for danger everywhere because it feels threatened. It feels under threat all the time. And this comes from experiences earlier in life where there was some kind of threatening situation that you lived through.
Mm,
but it somehow this has kind of influenced your subconscious mind into thinking the world is a very dangerous place, right? And so now you're reacting to pollen, you're reacting to mold, you're reacting to the foods you're eating. I mean, dust, right?
Everything is seen as a threat.
Relatively
Yeah.
benign things like food, suddenly, your limbic system's like acting out and it's saying danger, danger, danger all the time. And since the brain is the boss of the immune system, it is calling for that immune response over and over and over again to the point where the immune system is exhausted, right? And it is attacking things inappropriately, like your own cells, right? It is ignoring things it should be dealing with, like viruses, bacteria, fungi, whatever. It's just ignoring it, cancer cells, right? It's just ignoring it because it's like, I can't, all this, I'm constantly attacking all these other things that are happening nonstop, the chemical sensitivities, the food sensitivities, the environmental irritants. And so this leads to a pattern of dysregulated immune function, which can lead to all kinds of chronic illnesses, even beyond this allergies and sensitivities. And so again, by working with the brain, by working with the beliefs, the trauma experiences, all these different entry points that we have that we use with the MAP method, we can start to turn this around. Yeah. And it's a little bit like what you experienced. I mean, you didn't have a big chronic diagnosis, but, who's to say, if 5 years from now, with small things have turned into big things,
Yeah, it happens. It happens.
Yeah. Well, anyway, Derrick, I want to thank you for taking the time to talk with me today, sharing your experiences with the MAP.
No, I really appreciate it. Thank you for having me here.
Yeah.
Yeah, and giving me a chance to, share some of the benefits that I've gotten from MAP. And yeah, I definitely will be back. So. Yeah, thank you so much.
You are welcome.
Thanks for joining us for the Flourish with Functional Nutrition podcast. Please listen again and remember to follow us and leave a review on iTunes, Spotify, Google Play, or Stitcher. To learn more about the MAP Coaching Institute, visit mapcoachinginstitute.com. To learn more about Mind Remap for Health, visit mindremapforhealth.com. Until the next time, be well and flourish. Content of this podcast, copyright 2021 by Twin Cities Nutritional Therapy. Music by Barbara Ben.